think I don't see any other council members. I think we're I'll send a reminder. Sounds like some computer issues and folks should be on shortly. Thanks for your patience. Okay, I see Councilmember Coombs.
Hello.
I think we're still waiting for Councilmember Marcano. We'll give it a minute or so, and if not, we'll go ahead and get started.
Sounds good.
All right, I think we're Councilmember Marcano is still working on joining, so we can go ahead and get the meeting started. We are starting with the approval of the July 6th meeting minutes. Councilmember Coombs, do you have any changes?
Nope, I'm good.
Right. I also don't have any changes, so we can go ahead and approve those meeting minutes. Are there any announcements for the good of the whole?
morning, Councilmember Murillo. I did want to introduce Kelsey Delaney. Kelsey, if you can just come off camera and introduce yourself. Kelsey is our new housing compliance officer here at the city. We do have a strong compliance team. We did need someone to represent us internally and externally, and that is the role of Kelsey. There's a lot of regulation requirements that we have to follow, specifically for HUD funding, and so she will be helping us with that. So, Kelsey, go ahead and introduce yourself.
Hi, everyone. My name is Kelsey Delaney. I've been working with the city for about 4 weeks now, and I'm excited to continue learning and learning from the team and working with everyone. So thank you for letting me be here.
Thank you, Kelsey. And that's all. Thank you.
Great, welcome, Kelsey, and thanks for sharing that, Alicia. All right, let's go ahead and just jump into our content with an update from our Housing and Community Services team, the Homelessness Division.
All right. Good morning, everyone. My name's Emma Knight. I'm the manager of our homeless programs, and just a quick update on some of the things that we've been doing within the homelessness division. Thank you. Maddie's on it with going to the next slide for me. So we're just going to be talking really quick today about our notice of funding that's coming out for our homeless services, really quick update on the navigation campus, and a quick overview of the point in time. Next slide, please. So we're just going to start with the notice of funding. Next slide, please. So we're going to be releasing this on August 15th. Next week, we're having on Monday a pre-meeting with all the service organizations just to let them know that it's coming out and just kind of what some of our funding levels are going to be, so they're not, just so they're up to date and not caught off guard by some of the changes we're making. And then just, yeah, August 15th, we'll be posting. The 21st, we'll be having an info session and a Q&A for all the agencies who are interested in applying. And then they'll be due on end of business on the August 28th. We'll hope to finish reviewing all of the applications by September 8th and then bring it to study session, or I probably need to get it in horns first, but yeah, we'll figure that out. I'll update that. Sorry about that. And then hopefully get it to regular council on the September 15th, but I'll have to relook at the calendar based on all of those meetings again. Next slide, please. And I just wanted to give you a quick update on some of our funding levels. So I did it year for year where we are at with funding. So you can see our marijuana funding is down by about half from 2022. So that's one thing I'm going to be updating all of our service providers on. It's just that the revenue is down, so we're going to have less to be handing out to everyone. All of our other funding is pretty similar from last year from federal funds. Public safety was down last year or this year for funding from 2022, but it is about the same as it was for this year going in 2024. So that's the funding streams we have. And then we do still have some funding from the camping ordinance that will be going to, that was already allocated to Salvation Army for Save Outdoor Spaces for running some of that. So that will be able to offset a little bit of this, but will be really less funding than we had previously. Next slide, please. And just a really quick update on some of the outcomes from 2022 to 2023 for what these funds have provided. So we've served just under 3,000 people and just over 1,000 households with disabilities. Employment, education, and assistance, which includes job searches, TANF hours, and school. We've helped serve 493 folks with things like that. And then we've done case management for over 900 people, and behavioral health services for 408. And these are numbers from between all of our service providers that we've funded. So this isn't just one service provider for all of these. Next slide, please. Yeah, so Navigation Campus, quick update on this. So yeah, you can go to the next slide. Thanks. So the state RFA for the, which was requests for applications for the Navigation Campus, was due on Monday. We actually submitted it on Thursday of last week to make sure that we, got everything done in time, weren't up to the wire, wanted to get that in a little bit early. And so we submitted that as an ask of $22 million is what we were requesting from the state. And we've gotten match funding. You can see that list below. My only update on this is Douglas County's ARPA funding. They have approved that, but it was at 1.125 instead of 1.25 since I made this slide. So everything else on there is accurate, though, for match funding that we are providing for the Navigation Campus. And that rendering on the side is just kind of what the site could look like. We don't have a final design or anything. That's going to be determined once we know how much funding we actually have, once we hear back from the state, and when we're working with our group of stakeholders on actual design. Next slide, please. And just a really quick update on the point in time count, because we just got that in. And I just want to do a couple quick, I guess, level setting on what to expect with point in time. I think you council members probably have a pretty good understanding, but for anyone else watching, this data that we get from point in time, it represents people counted experiencing literal homelessness, which is a HUD definition, which is fairly narrow, on only one night in January, and it's a snapshot for homelessness on that single night. And we try not to compare this year over year because there's so many variables that go into this. It's not like the most accurate way to compare where we're at in our population. Next slide, please. And I just want to explain what literal homelessness is. As I said, that's all we can count on the point in time count night. So that's an individual or family who lacks a fixed, regular, or adequate nighttime residence. So folks who are staying in a place not meant for human habitation, or folks in a shelter, which could include congregate shelter, transitional housing, hotels or motels that are paid for by an organization, or folks exiting an institution where they were residing for 90 days or less. So that is very narrow definition of who we can count on that one night. So really that's excluding anyone who is paying for their own hotel that night because maybe it was really cold and all you council members were there that night or that morning. So, you know, it was extremely cold that night that we were counting folks. And we can't count folks who were couch surfing, and it really narrows who we can count experiencing homelessness in that one night. Next slide, please. So for our sheltered and unsheltered count, we in the whole Denver metro area counted just over 9,000 people, and in Aurora we counted 572. And so last year in our count we had, I think, 619 people. So this looks like by just these numbers that our population has gone down, but I would not say it has, based on usage of shelters and all the folks we're seeing camping outside. Again, it's hard to count year from year with the point in time count. It just kind of gives us a snapshot of where we're at. But I wouldn't call that a significant enough drop to say that means that our population has actually decreased at all. And 409 people were sheltered this year, and 163 were unsheltered. And that 409 sheltered number is higher sheltered than what we counted the previous year, which means, again, more people were probably staying inside that night, which is probably why that count looked lower, because more people were probably seeking shelter in other ways as well, other than just our traditional shelters. So 2 in 5 people, this was their first time experiencing homelessness. That's a pretty high number for first time homelessness. And 25% of folks reported a disabling condition, 26% physically disabling condition, 7% developmental condition, 26% mental health concern. These are all, again, self-reported during the count. 20% reported chronic health condition, 3% a traumatic brain injury, 25% reported substance use, and 12% reported domestic violence was their cause for homelessness. So that's just kind of a breakdown and shows you some of the reasons why people may be experiencing homelessness and how high those numbers are within this population. And if you want more information, MDHI, or Metro Denver Homeless Initiative, has a much better breakdown on their website, and they have a dashboard that you can go in and look at, and you can compare it to other counties and just see a more specific breakdown of all the numbers. I didn't want to put everything on here. Next slide, please. Oh, that's the end. So yeah, that was the point in time count and all of our other things going on right now. And actually, another quick update while I have you here, we're actually in the midst of hiring 2 outreach workers. There'll be FTEs, and then I'm in the midst of also trying to hire a replacement for one of my abatement liaison staff. So that we'll be back up to 2 people. And we recently received a grant from Community Solutions to hire a data analyst. So we'll be posting that position soon. So the homelessness program is growing, and we're getting more staff and getting more capacity. Any questions?
None for me,
Murillo?
Councilmember.
Yes, thank you. So I have a couple regarding the point in time count. I had received a question, and I don't know if this is reflected in the MDHI data, about whether we know if folks are becoming homeless in Colorado or if they're coming from elsewhere and are homeless upon arriving here.
You know, I cannot remember if that is reflected on the MDHI portal. I can certainly look and see if it is and get back to you on that. I don't think that was a question, but maybe it might have been a question we asked, but I'll double check and get back to you on that. That is something we try to ask in our regular HMIS questions when we're intaking folks. But I can look into that for you.
Okay, thank you. That's super helpful. And then on the behavioral health component and serving folks with behavioral health services, I've been hearing some concerns from folks about just kind of our capacity and wait lists when they try to get access to mental health services, especially for youth. Is there anything in particular that we're working on as far as just capacity building? I know obviously we have a general shortage of folks that are able to provide those services, but is there anything that we're actively doing as a city to try to increase that capacity for behavioral health folks?
Absolutely, and I know Jessica knows more about this than I do, but Aurora Mental Health is building their Potomac campus, which will have significantly more capacity and a lot more case management services there. I don't know if Jessica, you want to speak to that at all?
Yeah, I would say just more recently, we've been working with the walk-in clinic and the crisis clinic, and specifically, we've had a couple of opportunities to be a little more intentional about how we're working with youth and just sort of unaccompanied minors that go there. And then through the mobile response team, certainly is available during the hours and days that they're working. We're working on an expansion of that you all, I assume, heard about during your one-on-one meetings as well, to add another team. We've also been having some conversations with Aurora Fire Rescue around building out capacity with those teams, and looking at their community health program and just sort of revamping that a little bit. So those are some things that we're having conversations with. Internally, we don't have a specific sort of funding stream for behavioral health services, but I would say specific to youth, several of the recipients of our NOFO funding for youth violence provide behavioral health services as well. And so if there's sort of a gap that we're seeing, I would say that we would want to have conversations with some of the agencies we've already funded and see if we can tap into resources and best leverage those resources.
Okay, thank you. And Councilmember Murillo, can I ask one more question? All right, thank you. So I've been at a couple of meetings recently with the mayor where he has said that our state funding may be in jeopardy due to competition with Denver and the different types of programs that Denver is pursuing compared to us. Does anybody have any ideas about like how that process is moving forward and anything we may have heard about concerns regarding the campus that we're building and things we could do to improve our chances of success?
So I do know there were, as far as the navigation campus goes, there were, I don't know, 6 to 8 other applicants, including Denver. I know Commerce City turned one in, and Arvada and a couple other cities submitted applications for that. So there is competition for it. But in all of our conversations with the state, they have said they are committed to funding Aurora. So I do think we will get funding. I don't know at what level that will be, but I do think we will get funding from them for that. As far as other state funding streams, I'm not sure if Jessica or Roberto, if you've heard anything about that.
Definitely been a few applications that have gone in both from us and partner nonprofits and service providers in the city that have not been funded. And, I mean, certainly Denver has been funded. There's also been several other entities around the state, whether that's affordable housing projects or more of these transformational dollars which were under House Bill 1377 that were funded. And so I think we're just all kind of tracking what's getting funded both in Arapahoe County, Aurora, sort of the East Metro area versus what's getting funded in other places. So that might be part of it. I know Aurora Mental Health had asked for a greater amount than they had received and things like that. They've subsequently gotten some other funding from the state. And then I think just in terms of the, I think, I don't want to speak for the mayor, but in terms of the amount of attention Denver's gotten in the past few weeks related to what they're doing and working on, that might be some of where that's coming from. But there'll certainly be competition. But I would say of maybe the 6 applicants that went into the state for the navigation campus, some of them are just rehabbing an existing structure to create a day center. They're asking for maybe $1 or $2 million. It's a smaller amount of funding. They're not looking at sort of a larger transformational project with multiple different parts and pieces, with the transitional housing and emergency shelter and day center kind of all looped together. And so we're hopeful that there will still be a significant chunk of funding coming to Aurora for our campus.
I'll only add, Councilmember Coombs, that Jessica and Emma and their teams did a wonderful job putting together our application. It was submitted last week. We don't know when the response, hopefully soon, from the state. So I think we're in that period that if there's any conversations and putting in a good word, I'm sure there's no downside to doing that. I think we are in a good position in that we have lots of letters of support, dollars committed in a regional way with the counties, both Adams and Arapahoe and Douglas. I think in terms of the Eastern Metro region, the response is, I think, a real strong application in terms of addressing the needs in our area. But quite frankly, Denver has will probably be a large ask, is I think the concern in and how that money gets allocated, given that we do have a large ask as well. Whether we get kind of shrunk a little bit in terms of what they can provide. I think I hope that they'll give us funding, but it's a matter of how much. And if Denver's going to be, needing more or asking for more, it'll be difficult for the state to kind of figure that out. They know they need to solve and address both areas. How we shake out in that process is the question. It's been a little bit, as Jessica mentioned, a little bit of a mystery. Not a mystery, but we have, Aurora Mental Health didn't get anything. It was really odd. And so when they went their first round, they have subsequently been able to recover and get their funding. But my point being is it's been a little bit of a black box with the state and how they allocate. So we're a little nervous until they say, yes, we're ready to go. But I think we've put our best foot forward thanks to the efforts we've made with the counties and our own application and having a site that is owned by the city in a good part of that doesn't have, won't have a lot of the potential NIMBY issues that some other folks might have. So I think we're in a good place.
And just a quick follow-up. As far as the RFP for nonprofits actually operating, when will we have an update about that discussion?
Should have that soon. I cannot recall the dates we had it required for folks to submit by, but we did push it back by a week or two at the request of some of the applicants that were interested. So we should have an update at least at the next Horns meeting.
Great, thank you.
Just add to that, we had 4 agencies that attended our pre-proposal meeting we had about 2 weeks ago. And the feedback was we were asking for a lot. And so it was originally the 31st and we pushed it. I think it's maybe around the 14th. So we'll provide an update once we get those in there, and we have a robust committee put together, representation from the counties as their funding. We have folks with lived experience on that review piece, staff, and so pretty intentional about having a robust group to take a look at those as well.
All right, Councilmember Marcano, any comments, questions?
Yes, ma'am. Thank you. And sorry for joining late, everybody. So I guess first, with regards to funding from the state, I'm wondering what are our contingency plans if we don't get funded at the level that would be required for the campus?
So I know
Go ahead,
it is
Emma.
sorry, yeah, I got it. It's our intention to build a campus no matter what happens with the state, whether we need to scale down or not, depends on how much funding we get from them, but we are committed to building something to increase capacity for our population because we know it is important and we really need that for our folks experiencing homelessness. And we will seek other sources if need be. I do think we will get funded, at least a little bit from the state, though.
So, Councilmember Marcano, I think just even without the state providing any funding, we're in the neighborhood of $20 million that we have already have committed, both for our ARPA funds and other funds. And we would probably need to redouble back and find other funding sources, maybe some private funding sources, maybe looking back in what we have in some one-time funds for capital construction if we need to pull some more out of our general fund budget. But Emma's right. We would pursue a scaled down version. It may not be the version that we want, but we need to do something and we can't wait. So we would probably value engineer and look at a design and try to figure out what elements we can include to meet that project size, to right size what we have, waiting for another round. I mean, the ARPA funds, that's it. There's no more, there's not going to be another bite at the funds are kind of gone after this. So we would come back to the council with some options for some additional fundraising, I'm assuming, but also a scaled version and what elements we want to make sure we keep, what elements are flexible, what we want to do in terms of the programming in the site.
Okay, Thank you for that answer. And Councilor Murillo, I do have another.
Go ahead.
Good. Oh, thank you. So going back to the point in time count, if memory serves, when we went out, that was in the middle of that really brutal cold snap that we had at the beginning of the year. So it tracks that the sheltered homeless population, I think, increased. And I'm wondering, do we know if folks went to other nearby jurisdictions? Because I know that we've always had a capacity issue. That's in part of what we're discussing now, just given how cold it was for such a long amount of time.
I do not know if we had any folks go elsewhere. I think, as you said, we have people move back and forth all the time. So that's definitely, I think that would make sense to make that assumption that we did have folks seek shelter elsewhere. I think I'm sure we had folks in hospitals that night, which we can't count. I'm sure we had folks in like crashing on friends' couches and just in places we couldn't find them as well.
Yeah. So I guess on that point that you just brought up, I was not aware that we weren't tracking folks who end up in hospitals, for, like, say, frostbite in this case, right? Given the weather that we had been having. Is there a way that we can ensure that we're not losing track of folks that way? Because I think that when we're discussing, the impact of homelessness on the region, obviously we can, look at our own budget and see what resources the city is committing to it. But I know that this has a huge strain also on, the private sector, especially with hospitals and things of that nature. And I think those are facts and factors that we need to be able to account for. So what can we do to improve our data collection in that front?
So we were having conversations with hospitals this year before the point in time count to try to figure out how we can count as best as possible folks that are actually in the hospital that night. We didn't get it figured out this year. The hospitals they have a lot to go through before they can kind of work with us on some of that stuff. So that's an ongoing conversation we're having with them. Things we've done in the past is have a couple folks just outside the hospitals at that time and just ask them if anyone walking around, if they are experiencing homelessness and where they stayed that night. I think we're gonna have a more robust conversation with the hospitals this year. I know they want to be involved as much as they can as well in all conversations we've had with them, and we'll continue to try to bridge that gap that we're seeing.
Yeah, great. So where I'm leaning with this is I think would likely be a compelling argument to get them to help us financially with these endeavors if the state doesn't come through, just given how much this impacts them as well, right? Because folks who utilize them for emergency services, or their emergency services typically is their only primary care option, they're going to cost them a hell of a lot more than I think if they would help us address kind of like the root cause of the issues. It'll benefit everybody if we can get them on board to help us with that. So thank you for that answer. And that's all I have, Councilor Murillo.
Alrighty. All right, thank you for that. I think that concludes the business of the content part of our meeting. I think just another open call for any updates from community members before we adjourn. While we wait for folks, I want to confirm the next meeting, which is scheduled for Thursday, September 7th. Does that still work for you all?
I think so, but
Yes.
let me double check.
Okay.
Yeah, that works for me.
Yep, that's good for me.
All right. Not seeing any announcements or updates, and we've confirmed next month's meeting. So we are adjourned. Thanks, everyone.
All right. Thanks, y'all.
Thank you.
Bye.